The Revive IPT project was conceived back then in 2020 as a capacity building project, and basically wanted to address a number of challenges, especially when it comes to malaria prevention during pregnancy.
Since the inception of Revive IPT project in 2021, we have had immense activities towards revitalizing IPTp among pregnant women. At the facility level, we've had formal training on MIP. This had targeted the CHPs, had targeted the CHARs, targeted even the clinical staff at the facility. Apart from that, we've had support under Revive IPTp to run mentorship programs in facility. We have done support supervision in facility. We have even gone further to undertake quarterly data reviews when it comes to malaria in pregnancy data.
Currently, malaria in pregnancy is a major issue because it is affecting pregnant women in endemic regions mainly. And so the government has a policy in place that enables the mothers to be able to get IPTp antenatally, and they are getting it a dose every month. Another thing we have done, we are talking to adolescents. We are trying to talk to them and give them knowledge on the SP that they are supposed to get monthly. We are also working with partners to be able to give online health education to healthcare workers on improvement of IPTp uptake. Currently, we are well stocked with the SP, and we are ensuring that there will be no more stockouts as at current. Yes, and we have also been doing mentorship in health facilities to healthcare workers on when to give SP, when to start SP.
Well, the county appreciates the good outcomes that we're seeing from the study, and the county is very much committed to ensure that the achievement that we have seen through the program is really maintained and sustained over a longer period of time. And with this, therefore, the county will ensure continuous follow-up of pregnant mothers, continuous mapping and follow-up of pregnant mothers within the community by the use of existing community health systems.
So Suna West in particular, when we began the Revive IPTp project by KMET, malaria in pregnancy was at about 41%. Over the years, working with KMET closely to implement community-based approaches, doing awareness creation in the community, several activities in the community, we've seen a significant decline from 41% to 32.8%. For a better performance of IPTp as an indicator, then we really count on healthcare providers being our technical staffs at the healthcare facilities. We know the project has come to an end, but as a sub-county, we will not wish to end with the project. Rather, we wish to continue the gains that we've had, the gains that we've seen come with the Revive IPTp project in our communities. As a sub-county, we still need the support both from the county and the national level in terms of policy in regards to SP being distributed by community health volunteers. We need clear policy guidance on that, right from the national, then we can domesticate it at the county level, and then it become a standardized policy that can be used by our healthcare providers and our community members at large.
In Migori County, if I may start, we have been struggling with maternal health and the newborn health. And actually, currently, what we are putting on in place is that actually we have done a good supply for the SP in our facilities, almost all of them. And what we are now doing is just to improve on the uptake and to maintain the stock. So what we have done currently, what I'm going to do from what I've had here, because I actually had never done that survey which was done here, is to ensure that we struggle with the health education so that we can fight the behavior change in the community. We want to actually and inform them that it is their right to take it. And actually, if they don't take it, there is repercussion behind it.
Just to thank the county government of Migori and Kisumu. They have been very supportive in rolling out this intervention. Without them, we wouldn't have developed or generated all this important evidence, and also them being very listening in terms of paying attention to what the evidence is saying and what can we do given the evidence. How do we target our mothers? How do we map them? How do we strategize better? How do we include some of these findings in our action plans? That's what county has been able to kind of like do. So these are very important learnings, and we hope that they will continue to use the evidence to inform their interventions, because that's the only way they can be able to ensure that by 2027, as the strategy says, that at least we protect all our mothers from malaria living in these areas where malaria is quite endemic.